Today we're going to talk about the different classes of antibiotics and their mode of action. The first one we're going to talk about is the beta-lactams. They're the most widely used antibiotics, and some examples of these are penicillin, such as amoxicillin, and we also have cephalosporins, such as ceflexin. Their mode of action is to inhibit bacteria cell wall biosynthesis. The next antibiotic is aminoglycosides. It's a family of over 20 antibiotics. They contain an amino sugar substructures. Some examples of the aminoglycosides is streptomycin, neomycin, paromomycin, and their mode of action is to inhibit the synthesis of proteins by bacteria, leading to cell death. The next antibiotic is chloramphenicol. It's commonly used in low-income countries. Its mode of action is to inhibit synthesis of proteins, preventing growth. It's no longer a first-line drug in any developed nation, except for conjunctivitis, due to increased resistance and worries about safety. The next antibiotic we're going to look at is glycopeptides, common drug of last resort. It consists of carbohydrate linked to a peptide formed of amino acids. And the example for this antibiotic is vancomycin. Its mode of action is to inhibit bacteria cell wall biosynthesis. The next antibiotic we're going to look at is the quinolones. Its resistance evolves rapidly. They all contained aromatic rings with a carboxylic acid group attached. One example is levofloxacin and ciprofloxacin. Its mode of action is to interfere with bacteria DNA replication and transcription. The next antibiotic that we're going to discuss is the oxazolidinones. That's a hard one to say. They're a very potent antibiotic. It's commonly used as a last resort. They all contain 2-oxazolidone somewhere in their structure. Some examples are cycloserine and linezolid. Their mode of action is to inhibit the synthesis of proteins by bacteria, preventing growth. Now let's look at our sulfonamides. It's the first commercial antibiotic, and they all contain a sulfonamide group. Some examples are Prontosil and sulfadiazine. Their mode of action, they do not kill the bacteria, but they prevent their growth and multiplication, and they cause allergic reactions in some patients. Now let's look at our tetracyclines. It's becoming less popular due to the development of resistance. All contain 4 adjacent cyclic hydrocarbon rings. And our examples of this particular type of antibiotic or class is tetracycline, doxycycline, and limocycline. The mode of action for this antibiotic is to inhibit synthesis of proteins by bacteria, preventing growth. Our next antibiotic is macrolides. It's the second most prescribed antibiotic. All contain a 14, 15, or 16-membered microlide ring. Some examples are erythromycin, clarithromycin, and azithromycin. The macrolide's mode of action is to inhibit protein synthesis by bacteria, occasionally leading to cell death. The next class of antibiotic is ansemamycins. They can also demonstrate antiviral activity. All contain an aromatic ring bridged by an alphatic chain. Some examples of this particular drug is rifamycin or rifamycin and geldanomycin. Its mode of action is to inhibit the synthesis of RNA by bacteria, leading to cell death. Our next class of antibiotic is two groups of antibiotics that act synergistically, and they are the streptogrammins. It's a combination of two structurally differing compounds from groups A and B. Some examples of this particular class is pristinamycin 2A and pristamycin 1A. Its mode of action is to inhibit the synthesis of proteins by bacteria, leading to cell death. And our last class of antibiotic is lipopeptides. Instances of resistance are rare. All contain a lipid bonded to a peptide. And some examples of the lipopeptide is dapomycin or surfactant is another example. And they disrupt multiple cell membrane functions, and this leads to cell death. So I hope you got some good information from this video. And this is the different classes of antibiotics and their mode of action. Thanks.